As a physician who's spent decades caring for the aging brain, I've seen my share of surprises. But one night, something truly shook me. A 72-year-old gentleman passed away in his sleep. No prior stroke, no heart history, just a quiet, uneventful night and a tragic morning. When I reviewed his case, what shocked me was this. The suspected cause wasn't a disease. It was a vitamin. Yes, a vitamin he had been taking faithfully every night for the past 3 months. You see, many seniors today take supplements thinking they're doing something good. And most of the time, they are. But here's the truth nobody tells you. Even vitamins, when misused, can become silent threats. I've cared for countless patients over 60 who come in with trembling hands, blurred memory, blood pressure spikes, and no one knows why. They eat well, they don't smoke, they walk every morning. But hidden beneath those routines are a few harmless pills, self-prescribed, unchecked, and dangerously misused. Today, I want to speak from the heart, not from a textbook. If you or someone you love takes daily vitamins, especially after the age of 60, I urge you to pause and truly listen. Because the truth is, certain vitamins, when taken in the wrong way, wrong dose, or wrong timing, can quietly lead to stroke, brain bleeds, or even fatal heart attacks, sometimes overnight. This isn't to scare you, it's to protect you. We'll explore the 5 most dangerous vitamin mistakes seniors make, and then I'll guide you toward the 5 essential nutrients that can truly support a healthy brain, strong heart, and vibrant mind. My friends, knowledge is power, and in this case, it may save a life. So let's dive in together and take back control of our health, one smart choice at a time. If you find this message helpful, please don't keep it to yourself. Hit the like button, share this video with someone you love, and follow Dr. Kim's home clinic for more practical, life-saving tips. Because we're not just living longer, we're living wiser too. The 5 dangerous vitamins seniors must use with caution. Vitamin number 1, high-dose vitamin E, the silent blood thinner. Let me tell you about a case I'll never forget. It was nearly midnight when a son rushed into the ER, eyes red, voice trembling. His 70-year-old mother, healthy, cheerful just hours ago, was now unconscious, suffering from a massive brain hemorrhage. No history of high blood pressure, no diabetes, nothing that explained the sudden collapse. But then, he handed me something from his pocket, a bottle of high-dose vitamin E. She had been taking it every night for over a year. It's good for the skin, she was told. It slows aging. But what no one told her was that in large doses, vitamin E can dangerously thin the blood, so much so that it disrupts the body's natural ability to clot. In seniors, where blood vessels are already fragile, this becomes a recipe for disaster. A tiny leak becomes a flood. A thin vessel becomes a burst balloon. Above 400 IU per day, vitamin E interferes with platelet function, increases risk of brain bleeds, weakens heart rhythm, and may even raise cancer risk in men. So I ask you now, is it worth trading smooth skin for a stroke? Please, check your label, talk to your doctor, and if you're taking high-dose vitamin E without guidance, consider stopping today. Vitamin number 2, vitamin D, strong bones, hard arteries? It sounds strange, doesn't it? A vitamin known for supporting bone health could harden your blood vessels? That's exactly what I discovered in a thin, kind 74-year-old woman who came in with skyrocketing blood pressure. After ruling out all common causes, we found it. She'd been taking 5,000 IU of vitamin D daily for nearly a year. Not by doctor's order, but a friend's advice. Here's the danger. Too much vitamin D increases calcium in the blood, and that excess calcium doesn't just strengthen bones, it can calcify arteries, especially in aging bodies. Imagine pouring cement into old water pipes. That's what happens in your blood vessels, leading to heart disease, stroke, kidney stones, and fatigue. Seniors are particularly vulnerable, especially those already on calcium-rich diets or who take other supplements. So before you reach for that bottle, get your vitamin D levels tested. And when possible, choose sunshine, eggs, fatty fish, and mushrooms first. Vitamin number 3. Synthetic vitamin A, the brain's hidden enemy. Want brighter eyes and glowing skin? That's the promise many hear about vitamin A. But what's not said enough is this. Too much synthetic vitamin A can damage your brain. One patient of mine, sweet lady in her 60s, came in with severe headaches, confusion, and vomiting. We feared a stroke, but scans showed no bleeding, no tumors. The problem? Months of high-dose vitamin A oil capsules. Vitamin A accumulates in the liver and can raise pressure inside the skull, a condition called pseudotumor cerebri. Left untreated, it causes seizures, blindness, or coma. Even worse, vitamin A builds up quietly in older adults due to declining liver function. It doesn't flush out like vitamin C or B. It stays. It stores. And when the body can't handle it, it breaks. So please, if you're taking vitamin A, be cautious. Natural sources like carrots, pumpkin, eggs, and animal liver are far safer and more balanced. Vitamin number 4. Vitamin B6. From nerve support to nerve damage. Here's a paradox. The very vitamin meant to support nerve health can actually destroy it when taken in excess. I saw this in a petite 68-year-old woman who walked like she was on clouds, unsteady, disoriented. She hadn't had a stroke, but what we found, she'd been taking 100 milligrams of B6 daily for 6 months, thinking it would help with fatigue and leg pain. In small doses, vitamin B6 helps nerve function, but above 50 milliliters daily for prolonged periods, it can cause peripheral nerve damage, tingling, numbness, muscle weakness, even difficulty walking. Worse, early symptoms are subtle and easy to ignore, especially in seniors who already assume it's just aging. If your hands feel numb, your balance is off, or you've been taking B6 daily, please check with your doctor. B6 is best absorbed through diet: bananas, chicken, potatoes, sunflower seeds, and salmon. Supplements should always be low dose unless prescribed. Vitamin number 5. Vitamin K, the blood clot trigger. Let me tell you about Mr. Lee, an active 72-year-old who came in gasping for breath, clutching his chest. Within minutes, we found it, a blood clot blocking his coronary artery. What made it worse? He'd been taking vitamin K daily, no prescription, just advice from a neighbor. Now, vitamin K is important. It helps blood clot when you're injured. But for seniors, especially those already on blood thinners, it's risky. It can cancel out medications like warfarin or aspirin, leading to unexpected clots, strokes, or heart attacks. Vitamin K is found in leafy greens like kale and spinach, as well as liver and soy oil. That's why it must be monitored if you're on heart or blood pressure meds. The smallest clot in the wrong place can cost a life. Please, don't let that happen. In the next part, we'll talk about the 5 essential nutrients that every senior should consider. Nutrients that truly support heart, brain, and blood vessel health. But before we go, if you've been taking any of the vitamins we just discussed, please take a moment today to review your labels. Talk to your doctor. And if this video brought you value, please hit that like button, share it with someone you love, and follow Dr. Kim's home clinic. Together, we can make smarter, safer choices, because our health deserves nothing less. Now, after everything I've shared about the risks of certain vitamins, you may be asking yourself, so, what can I take safely, doctor? That's a wonderful question, and I'm so glad you're thinking that way. Because while some supplements can harm if misused, there are others, when chosen wisely and used correctly, that nourish the brain, protect the heart, support memory, and even reduce stroke risk. These are the 5 nutrients I recommend most often to my senior patients. I call them the Golden 5, gentle protectors of your long-term health. 5 nutrients seniors should take to stay sharp, strong, and safe. Nutrient number 1, omega-3. Nature's lubricant for brain and blood vessels. Imagine your blood vessels as thousands of little water pipes. Now imagine trying to pump thick, sticky blood through them every day. Over time, they clog. They narrow. They strain. Omega-3 is the oil that keeps that entire system running smoothly. It's a healthy fat found in fatty fish like salmon and mackerel, in walnuts, flaxseed, and some plant oils. And it's incredibly powerful. It protects your brain by preserving the membranes of nerve cells, keeping your memory sharp and your thoughts clear. It thins the blood gently, reducing the risk of clots, strokes, and heart attacks. It lowers bad cholesterol, LDL, raises good cholesterol, HDL, and reduces inflammation in the body. The World Health Organization recommends that adults get 250,000 to 500 mg of omega-3 daily, ideally from diet or from safe, mercury-free supplements if needed. If you want to keep your heart strong and your mind clear, omega-3 is one of your best allies. Nutrient number 2, vitamin B12. Power for your nerves and mind. Let me tell you something most people don't know. Many symptoms seniors blame on just getting old might actually be due to B12 deficiency. Do you ever feel like your feet are tingling? You forget names? Your balance is off? Your hands feel weak? That may not be age, it could be a quiet lack of B12. Vitamin B12 acts like electricity for your nervous system. It keeps your brain's messages flowing and your muscles coordinated. It also helps your body make red blood cells, carrying oxygen to your heart and brain. But after 60, our bodies don't absorb B12 well from food. And medications like acid blockers, diabetes drugs, or a vegan diet can make it worse. I recommend getting your B12 levels tested, especially if you feel tired, foggy, or off balance. If low, supplements or B12 injections can make a world of difference. Foods like beef, liver, eggs, fish, and dairy are also great sources. B12 isn't just for memory. It's for keeping you upright, energized, and connected to your surroundings. Nutrient number 3, magnesium, the heart and sleep whisperer. Ever feel your heart race at night or muscles cramp while you're trying to sleep? You might be missing a quiet, humble mineral, magnesium. Magnesium helps regulate blood pressure, heart rhythm, nerve signals, and muscle function. Think of it as the body's natural calming agent. It reduces the risk of high blood pressure, diabetes, and even osteoporosis. It promotes deeper sleep by relaxing muscles and calming the nervous system. It also helps your body use calcium and vitamin D properly without hardening arteries. Magnesium is found in dark leafy greens, nuts, seeds, whole grains, bananas, and fatty fish. The ideal intake is around 320 to 420 ml per day, depending on age and gender. Just be careful with high-dose supplements, especially if you take heart or blood pressure medications. Food first is safest. Nutrient number 4, choline, memory's unsung hero. Choline may be a new word to you, but your brain has known it for decades. It's the main ingredient for producing acetylcholine, a chemical that helps you remember names, directions, conversations, everything that makes you you. After 60, choline levels drop. That's why some seniors begin to feel foggy, forgetful, or mentally off. But the good news? Choline is easy to replenish. You can find it in eggs, especially the yolk, liver, soy, cauliflower, and broccoli. The U.S. Institute of Medicine recommends 425 to 550 mg daily, yet most people only get about half that. Choline also helps prevent fat buildup in the liver, a bonus for those managing fatty liver or high cholesterol. Your memory is precious. Choline helps protect it. Nutrient number 5, coenzyme Q10, energy for the heart and brain. Have you ever felt breathless on a short walk? Or mentally sluggish, like your brain has low battery? That could be a sign your body is running low on CoQ10, a natural compound your cells use to make energy, especially in the heart and brain. After 60, CoQ10 levels drop naturally. And if you're on statins, cholesterol-lowering medications, they drop even faster. CoQ10 boosts heart strength, balances blood pressure, and sharpens cognitive function. You'll find it in foods like fatty fish, beef, organ meats, broccoli, and avocado. Supplements can also help, especially for those on long-term heart medications. Think of CoQ10 as fuel for your internal engine. Without it, the machine slows down. Now that you know what nutrients to avoid and which to embrace, let me share with you something just as powerful. How you take vitamins matters just as much as what you take. Because even the best vitamin, taken at the wrong time or with the wrong food, or worse, with the wrong medication, can do more harm than good. Let's finish strong with the 4 worst mistakes seniors make when taking vitamins and how to avoid them. The 4 worst mistakes seniors make when taking vitamins and how to avoid them. Mistake number 1, taking vitamins on an empty stomach. Let me start with one of the most common things I see in my clinic. A sweet gentleman told me proudly, "Doc, I take my vitamins first thing every morning, before breakfast, right after brushing my teeth. I never forget." But what he didn't know is that he was absorbing almost nothing. Many vitamins, especially A, D, E, and K, are fat-soluble. That means they need a little bit of dietary fat to be absorbed properly. When taken on an empty stomach, these vitamins often pass through the digestive system unused, wasted. Worse, taking vitamins without food can upset the stomach, cause nausea, or trigger heartburn. I've even seen some patients feel dizzy or jittery, especially if they're taking B vitamins or multivitamins right after waking up. My advice? Take vitamins 30 to 60 minutes after a meal, preferably breakfast or lunch. That's when your body is awake, your digestion is active, and the nutrients have the best chance to do their job. Mistake number 2, taking vitamins right before bed. I understand, we're all busy. And for many seniors, nighttime is the quietest time. So popping a vitamin before sleep sounds convenient. But here's the problem. Some vitamins wake up the body. B-complex vitamins, for example, can stimulate the nervous system. Vitamin C can increase alertness. Taking them late in the evening may lead to restless sleep, a racing heart, or even anxiety. And while you're sleeping, your liver and kidneys slow down too. That means any vitamins you take close to bedtime might not be processed efficiently. They can linger, stress your organs, and even cause interactions with medications taken at night. So remember, avoid taking vitamins after 7 p.m., especially if you're on medications. Let your body rest. Let your organs recharge. Choose daytime hours when your system is ready to absorb and process nutrients safely. Mistake number 3, mixing vitamins with prescription medications. This is one that worries me most because the effects are often silent until it's too late. I've had patients taking blood thinners like warfarin or aspirin and unknowingly adding vitamin K supplements. What happens? Their medication stops working, clots begin to form, and strokes become a real risk. Others take vitamin E, thinking it helps the heart. But when mixed with certain heart or anti-clotting drugs, it increases the risk of internal bleeding. Vitamin C, when taken with some antacids or kidney medications, can also strain the body, especially in seniors with declining kidney function. Always space your medications and supplements by at least 1 to 2 hours. And even more importantly, ask your doctor or pharmacist before adding any vitamin to your routine. Especially if you're on chronic medication, it's not just about what you take, it's when and how. Mistake number 4, taking vitamins with sugary drinks or condensed milk. This one always surprises people. Many older adults prefer taking vitamins with sweet drinks, orange juice, milk coffee, condensed milk, or canned beverages. It tastes better. They say. It goes down easier. But here's what they don't realize. Sugar changes how vitamins are absorbed. Excess sugar can alter stomach acidity, damaging water-soluble vitamins like B1, B6, and C before they're even absorbed. Sweet drinks also cause a sudden spike in insulin, especially risky for anyone with diabetes or metabolic issues. Worse yet, additives, preservatives, and caffeine in packaged drinks interfere with the liver's ability to process nutrients. Over time, this habit can lead to fatty liver, poor sleep, or even nutrient deficiencies, despite taking supplements daily. The best way to take vitamins? With plain room temperature water. Nothing fancy, nothing sugary, just clean, gentle hydration. Because your body knows exactly what to do with water. It's the perfect partner for every supplement you take. So now you know the dangers of certain vitamins, the 5 essential nutrients to protect your brain and heart, and the 4 most common mistakes seniors make when taking them. But let's bring it all together with one last gift: the 4 golden rules of vitamin use after 60. These are the habits I teach every patient of mine. Simple, science-backed, and life-protecting. The 4 golden rules for seniors. When using vitamins wisely and safely. Golden rule number 1. Only take vitamins when you truly need them. One of the most dangerous assumptions I see is this: well, everyone's taking vitamins, so I should too, just to be safe. But here's the truth. Vitamins are not harmless candy. When taken unnecessarily or in excess, they can accumulate in the liver, harden blood vessels, harm the brain, and even increase the risk of stroke. Especially the fat-soluble ones, A, D, E, K, don't flush out easily. They stay in the body, build up silently, and cause damage that doesn't show up until it's too late. If you're tired, dizzy, forgetful, or feeling off balance, get a blood test. Let your doctor confirm if there's a real deficiency. Your health doesn't depend on how many pills you take. It depends on how well you understand your body's real needs. Golden rule number 2, prioritize nutrients from natural foods. Let me ask you this. If I gave you a choice between a vitamin capsule and a beautiful, home-cooked meal full of green vegetables, fish, eggs, and nuts, which one do you think your body prefers? Food is the language your body understands best. Nutrients from whole foods come with enzymes, fiber, and other compounds that help your body absorb them gently and effectively. For example, vitamin A in carrots is absorbed better when eaten with healthy fats. Vitamin D in eggs works better when paired with magnesium from greens. If your diet is rich and balanced, you may not even need supplements. Even a simple meal, spinach, a boiled egg, and a piece of salmon, can give you omega-3, B12, choline, magnesium, and more. So eat wisely, eat colorfully, because no pill can replace the power of a well-balanced plate. Golden rule number 3, combine vitamins with healthy lifestyle habits. Many people hope vitamins will fix everything, but the truth is, vitamins can only support you if you're doing your part. If you take vitamin D but never get morning sunlight, if you take magnesium but sleep at 2 a.m. every night, if you take B-complex but live under constant stress, then those pills won't reach their full potential. Vitamins are like fertilizer, but your lifestyle, your sleep, hydration, movement, and mindset is the soil. Together, they grow strong roots of health. Simple daily habits like walking 15 minutes in the sun, drinking more water, stretching before bed, or practicing breathing exercises can amplify the effects of every nutrient you take. It's the combination that makes the difference. Golden rule number 4, always talk to your doctor before combining vitamins with medications. This last one is crucial, and it comes from a place of love and protection. If you're taking medications for heart disease, blood pressure, diabetes, or joint pain, and I know many of you are, please don't add vitamins without guidance. Some combinations are dangerous. Vitamin K can block blood thinners. Vitamin E can cause bleeding with aspirin or warfarin. B-complex can affect your heart rhythm if combined with diuretics. And even multivitamins with dozens of ingredients can interact with sleep aids, antidepressants, or blood sugar meds. Always ask, "Doctor, I'm thinking of taking this vitamin. Is it safe with my medications?" It's a small question, but it could prevent a big emergency. Closing words from Dr. Kim's heart. My dear friends, vitamins are not good or bad by themselves. They become helpful or harmful depending on how, when, and why we use them. I hope that after today, you feel more confident, more informed, and more in control. You now know which vitamins to avoid or use cautiously, which nutrients truly support aging bodies, what mistakes to avoid, and the 4 golden rules to guide your supplement routine. And above all, you now know that your health is worth protecting, not just with pills, but with knowledge, care, and thoughtful choices. If this message helped you or someone you love, please do something kind today. Hit the like button, share this video with your family or neighbors, and subscribe to Dr. Kim's Home Clinic so we can walk this journey of wellness together. Because living longer is good, but living well, living clear-minded, pain-free, and full of purpose, that's what I want for you. Thank you for spending your time with me today. I'm Dr. Kim, and I'll see you in the next video.